Progress for everybody.
Yeah.
Okay. Hello, everyone. This is our final group project for the IPTS group project. Off to the first sort of question.
So for radical belonging team definition, when we were thinking about this definition, we looked at literature. We went ahead and asked a lot of members of our workplace, and we also just brainstormed our thoughts about what radical belonging means. And this is the definition that we came up with. We said that radical belonging is a guiding principle that reaches towards change through three crucial aspects: social belonging, academic belonging, and democratic belonging. Social belonging encourages respect, appreciation, and acceptance of differences. Social belonging is vital to creating synergy and a strong work environment. Academic belonging stems from a welcoming environment in which learning is encouraged and collaborative teamwork is emphasized. This includes staying up to date on current research and policies. Democratic belonging focuses on knowledge, skills, and structure, as well as participatory action. Through these essential aspects, radical belonging can be achieved.
So in order to kind of support radical belonging, our recommendations through conversation and literature review really include our overarching recommendations include supporting and respecting everyone on the healthcare team, regardless of their race, creed, or sexual identity. And that another one should be that everyone should feel as though they are included and a contributing member of the team. So regardless of it's at the organizational or team or individual level, these two recommendations apply to all of them. When looking for recommendations, we broke it down into three levels: organizational, team, and individual. At the organizational level, our recommendations included allowing for more personal and wellness days, providing educational opportunities to those to learn more about radical belonging, and also rewarding those members of the team who exhibited loyalty to the organization. For the more personal and wellness days, through literature review, we found that a big sort of thing was that many individuals were burned out and decreased empathy, and that contributed to a lot of the problems that that led to a lot of the problems that led to not supporting radical belonging. As for the team level, our recommendations included enabling open communication within the team about problems related to radical belonging that other team members have witnessed. Additionally, being respectful of everyone on the team, as we may not know the full story behind the scenes of these individuals. At the individual level, our recommendations included effectively communicating with the team and the organization about any conflicts or problems that impede with their line of work or occupation.
We've learned a lot about what it means to be part of a healthcare team, and we acknowledge that teamwork collaboration is at the core of providing good healthcare. Being able to delegate roles provides comprehensive care that addresses all aspects of the patient efficiently and effectively. Making sure that there's reciprocated respect for one another's profession is a valuable aspect of being part of the healthcare team. Without it, care provided to an individual will end up with gaps. In order to provide the best care, we acknowledge the importance that each team member has and what they can bring to the table. Additionally, we've learned how to get everyone involved on the case. This includes types of communication styles and behaviors, such as assertive, aggressive, and passive. These were discussed in order to increase our ability to involve all types of team members into a patient's care plan, regardless of their communication. More importantly, we learned that effective communication is allowing everyone time to discuss their thoughts and opinions, come to a conclusion, and continue to relay information to the patient in order to increase their comfort with their next steps and who they're working with. Lastly, we've learned that we have the ability to improve patient outcomes through good communication, shared leadership, and balancing between shared thoughts and listening to others. With that, the importance of belonging in a healthcare team includes the ability to acknowledge others' knowledge in order to expand on our own. Collaboration of the healthcare team is key in order to understand the patient's needs and how to help them effectively. This is client-centered care, and having others listen and allow us to share our experiences and opinions gives us time to build upon each other's thoughts and provide the best care possible. Having a team provides the patient with multiple eyes on their case, thinking of all aspects and coming up with an appropriate patient goal to get them to their best health.
So kind of the next question was, what are the kind of the impact and stressors? What do these have on marginalized communities? And through conversation, possible solutions to assess if our interventions are properly addressing healthcare members of the marginalized community properly would include asking team members for their thoughts on possible interventions, asking for feedback from team members about the newly implemented interventions. Additionally, having periodic check-ins to assess the effectiveness of the newly proposed interventions. Another solution would include providing more focus and resources on interventions that have impacted marginalized communities. And then our last, but just kind of a limited list as of right now, providing additional social mental health resource to combat related stressors to team members with marginalized identities.
So to implement our proposed interventions, we would like to have weekly team meetings to give each member of the team time to talk about the positives and the negatives that they've been experiencing in any part of their job during the week. Every other member of the team is expected to listen and give the team member speaking their full attention. Once a list of concerns is compiled, the team will then brainstorm ways they can address any stressors present during the past week. Each team member is also given a chance to identify patient or staff needs or concerns regarding marginalized populations and/or belonging. We would also like to have a mental health professional available to the team before or after weekly meetings to ensure that they have a safe space to talk to someone when they need it. We also would like to offer our team any continuing education hours to learn more about marginalized populations and their struggles to access healthcare and things like microaggressions in the workplace, so that we can have a positive and cohesive team environment. So to implement these short term, we want to have weekly meetings, like I just said, for open discussion throughout the team. And during those meetings, gathering feedback and suggestions from the team about their needs and possible patient needs that might be identified. And then long-term, we plan to make those suggested changes within the healthcare team to meet their needs, their patients' needs, and the needs of others around them, and bring healthcare to those who are underserved and marginalized. Support from the healthcare team to get to these implementations and interventions to be successful would be everyone needs to be open-minded to new ideas and suggestions given by colleagues of other disciplines. Speak to team members with respect, use good listening skills, and keep lines of communication open with each other and with patients.
So now we're just going to talk about kind of the financial ask, impact, and funding of our proposed project. The biggest in terms of financial ask would be opportunity costs. These would include additional meeting times and check-ins and anything that takes individuals away from their occupation, as these are unpaid times, and this is just decreases the amount of times that they could potentially be making some sort of income. However, where they, where individuals may be losing income that way. The biggest thing is our impact on patient care through these proposed interventions. They aim to improve patient outcomes due to improved employee satisfaction and productivity, as well as decreased burnout and just overall increased mood. As for funding to fund our proposed project, these can include walkathons, grant applications both locally and nationally, also community and internal donations as well, either from local healthcare systems or just hospital grants as well.
So kind of with those aspects, thinking about how we're going to be looking at the effects of this implementation and what that might look like, kind of breaking it down into two separate ideas. One of sort of the more statistical analysis, looking at what the numbers of places where we implement this change look like. And then on the less analytical, statistical driven side, sort of the emotional impact, however that can be identified, looking at what it would be like before and after our implementation. Because one thing we want to know about this would be whether or not, it's something that statistically is making a difference, but as far as team members themselves, they don't really feel like much of a change has happened, or where there's some sort of large statistical change, or where there's not a large statistical change, but the team members feel as though there's been a great impact within the working environment. So kind of on the quantitative side, looking at a lot of statistics that are currently being tracked in many healthcare settings, that would be something that we would be taking a look at: monthly turnover rate, monthly percentage staffed by locums, travel, or any other sort of temp staffing, percentage of per month of shifts that are worked into overtime for those working on shift schedules, and kind of all these things. We'd obviously want to see a decreased turnover rate. Hopefully more team members are staying on as permanent positions and not having the chaoticness of temp staffing, things like that. That would be our goals for this. Looking at average length of stay, readmissions, line associated infections, patient care outcomes that are easily measured. And then sort of overall events, bed utilization rate, mortality rate, making sure that whatever changes we make are not decreasing patient safety, and hopefully we'd be seeing an increase in the positive aspects of those numbers. So a decreased mortality rate and a bed utilization rate that aligns with whatever the hospital goal would be. And then more on the qualitative focus side, so making sure that our team members are having a benefit to this beyond their productivity, more in the work-life balance side, and what their overall feeling of job satisfaction, things like that would be. So kind of with this, it would be pre and post implementation staff interviews, whether that be formally or informally, and looking at things like job satisfaction on a scale of 0 to 10, hopefully seeing an increase after our implementation, feeling of respect in the workplace, whether they agree that they do feel respected or strongly disagree, whether they think salary with respect to the position they hold is a fair return, whether they think they're being recognized for their work, whether our team members think that the job allows for a stable home life given whatever stressors they have at home, or whatever that looks like for them, and then whether or not they agree that this position they hold, they think there's feedback in the workplace, whether or not that's being received at all by those that have the power to make change within the organization, and then whether they think they're providing quality patient care, which is ultimately, one of the larger focuses that we hold. So kind of two breakdowns of it, quantitative and qualitative.
So to kind of go off of what everyone has talked about, I'll go over the sustainability and scalability of radical belonging in the healthcare system. So supporting radical belonging in the workplace will end up producing happier and more motivated workers, which may increase employee productivity and cause fewer work-related hazards, which would ultimately lead to better patient outcomes. And this is obviously a big incentive for companies to employ this radical belonging proposal we're giving in order to improve patient outcomes, which would overall decrease costs to the healthcare system. Other healthcare settings can implement our ideas through email chains, monthly meetings, check-ins, kind of like what everyone else has been talking about, to encourage these individuals to effectively communicate and respect each other to ultimately, again, provide the best care for each patient.
Now, that was the end of our presentation, our proposed plan. We thank anyone who's listening. Thank you for listening. If you have any questions, please let us know. Thank you.